And welcome everyone. I'm Michelle Nardelli. I'm the Associate Director of News and Communications at the University of South Australia, and it's an absolute pleasure to welcome you all here today in this new normal setting to bring you insights from some of our leading researchers who will be discussing parenting in a pandemic and how children's lives will change post-COVID-19. To start off, I want to take this opportunity to acknowledge that the University of South Australia is established on the traditional country of the Kaurna people of the Adelaide Plains. We recognise and respect their cultural heritage, beliefs and relationship with the land, and we acknowledge that they are of continuing importance to the Kaurna people living today. I also extend that respect to Aboriginal peoples from other areas of South Australia and Australia who have joined us today for this webinar. So before we begin, I just want to remind you of a few things. The chat function has been removed from the webinar, which means you can't ask questions in real time. But what we've done instead was encourage you to send through questions when you registered, and we've been really delighted that many of you have done that. So we'll attempt to get to the heart of most of those once the presenters have had a chance to speak, and then we'll have a bit of a discussion session. We're also recording this presentation, so you'll be able to view and share the webinar, and we'll be sending you some what we hope are useful links in the coming days, which gives you access to that, that recording and perhaps some other resources. So now it's my great pleasure to introduce our speakers. First off is Professor Carol Maher. Welcome, Carol. Carol is an expert in assessing how lifestyle impacts children's and adults' health. Her work has also seen her develop digital platforms to improve people's overall health and lifestyle, which has created a positive impact on Australian communities. Glad to have you with us today, Carol.
Thanks, Michelle. It's great to be here. Hi, everyone.
Also joining us is Professor George Siemens. George's research focuses on networks, analytics, and human and artificial cognition in education. He is the pioneer of massive open online courses, and his expertise on the influence of technology and the media on education, organisations and society has seen him speak all over the world. So we're very lucky to have him join us today. Welcome, George.
Michelle, thanks for the intro. Great to be here, and hello, everyone.
And Dr. Lesley-Ann Eyes' research focuses on the impacts of media on children's healthy development. She's also researching bullying, children's problematic sexual behaviours, and child protection issues with the aim of supporting teachers and informing curriculum. She lectures in child development, educational psychology and child protection at UniSA. Welcome, Lesley-Ann.
Good morning, Michelle. Thank you for having me.
It's great to have you here. So to say we've been living in strange and extraordinary times is an understatement. COVID-19 has completely turned our lives upside down in ways we would never have imagined only a few short months ago. And the impacts have been vast. School closures and the exodus of workers from office buildings to suburban homes, widespread unemployment, the closure of state borders, and a new razor-sharp focus on health, hygiene, and social distancing. Even for the most stoic and rational adults, it has been sudden, rapid, and a bit mind-blowing. But as we start to emerge from all the restrictions, we need to think about what has changed, and importantly, how that has affected our kids and family relationships. The impacts on kids' health, their education and relationships with friends, family, and their psychological well-being. Can we snap back to normal, or are there lessons to be learned that could and should change the way we live? Let's start off with you, Carol. Your research looks at the relationship between lifestyle and children's health and well-being. All these restrictions will have made a huge impact on the way kids normally live and enjoy themselves. How do you think it's changed health and habits, and how's your research going to elucidate that for us?
Sure. Well, as luck has it, we actually had a study that was already underway that started last year, where we've been tracking school children's activity patterns over 3 years. So because of that, we can actually look at what they're doing this year compared with last year. and we can see some really clear differences that would be due to coronavirus. So for example, children are getting about half an hour less physical activity every day at the moment. They're also getting about 15 minutes extra screen time, and they're also getting about 15 minutes extra sleep. So, you know, it's very obvious that children's lifestyles are different at the moment. So, of course, you know, there's organised sport had been cancelled. It's just starting to come back online. And then other activities, you know, like dance and, you know, club activities like scouts and so on have all been cancelled. So children are now mostly getting their physical activity at school. And even at school, there's quite big changes that have gone on. You know, the way they're running PE lessons is very different at the moment. They're avoiding sports that involve children having contact with each other. So instead, they're doing more sort of skill-based activities where the children can be spread apart from each other. And so basically sort of the net result of that is that children are getting less vigorous exercise than usual, because normally kids get a lot of the most vigorous activity through either sport or sort of games, competitive games. So that's a shame. And I guess, it will have health impacts, because it's the vigorous activity that has the really great health benefits for children. You know, it's when they're really running around and huffing and puffing, that's when, you know, it puts sort of stress on their lungs and their heart and muscles and bones. And it's that kind of stress that causes the body to adapt and get stronger. So, you know, at the moment, they're not only getting less activity overall, but they're also getting less particularly vigorous activity. So I guess you'd then say, well, you know, what can we do about that? You know, and I think, and one of the upsides of coronavirus is that generally we have a bit more free time at the moment, you know, because a number of those commitments have been taken out of our lives at the moment. So, you know, one way that families could look at trying to build a bit more exercise into their kids' day would be to look at whether they can add some more active transport to the kids' days. So, for example, you know, can they bike or scooter ride to school? You know, even if they drive, can you park a kilometre away and walk, you know, quite a good distance to school? You know, I think the added flexibility in our timetables at the moment gives us opportunity to add that kind of exercise. And another thing to be really mindful of is how we allow that sort of extra spare time to get filled. So in our use of time research, we know that there are particular kinds of activities that we think of as time reservoirs or elastic. So things like screen time and sleep are particularly activities that we see, you know, if you're short of time, that's often the things that we take time from. Where if we've got more time, then often we just suddenly put extra time into screens and sleep. So, you know, when it comes to kids' screen time in particular, I would really encourage parents to be mindful of what's happening with their kids' screen time. You know, the national guidelines say that children shouldn't get more than 2 hours a day of screen time for recreational purposes. And I think, in a way, that sends a message that all screen time is equal, and it really isn't. You know, there are so many different types of screen time, and they really have very different health and wellbeing impacts. So, you know, when it comes to kids' screen time, you know, I think we often hear the negatives, you know, because, you know, evidence is clear, you know, the children that get a lot of screen time are much more likely to be overweight and obese. You know, screen time has been linked to aggression and, you know, other negative behavioural outcomes. You know, of course, there's all potential for cyberbullying and so on. But, you know, actually there are a lot of great advantages to screen time as well. You know, for example, you know, we know that video games can help children improve their coordination. There's actually like incredible educational resources available online. Now children, if they use online in that way, they can really be pursuing, whatever topic is their passion and learn all about it. And also social media, used in moderation, can be a lot of fun and a great way to stay connected with friends. So I would really just be encouraging parents to try to use screen time mindfully so that their kids can get the good bits from it, and avoid the bad that tends to come with that really like prolonged sessions of screen time.
Thanks, Carol. That's really interesting. And I think it kind of segues into talking to George. George, without screens, without all this marvelous digital technology, we would probably not have all been able to stay employed, and kids would not have been able to continue their education as we've all like rapidly switched to online. Can you just talk to us a little bit about where the value of online in terms of education and where that might sit as we move post-COVID-19?
Well, I think there's a lot of the points that Carol made that certainly relate heavily to the experience all of us have now, where we spend greater portions of our days and our lives with digital technologies in some way. Whether it's a screen in the form of a laptop, or whether it's a mobile phone, or for children or other adults, it might be involved in games or game-based playing, or increasingly tools like virtual reality and other sort of simulated experiences. And I think one message that comes through quite clearly is we are not in the foreseeable future going to start using less technology. Like, it's at no point, I think, are any of us going to wake up and say, you know what, that's it. I'm at peak technology. It's time to start dialing back. It's every year, new technologies, new approaches, new resources that are made available. And as a result of that, we have a significant amount of attention now being paid to what do these extra tools and technologies do to us as people? How do they change our relationships? How do they begin to impact our mental health? How do they begin to influence the ways that we live a meaningful or a satisfying life? One of the big areas when it comes to schooling and the education system, which is my area of interest specifically, is that these digital technologies and online and digital learning has an extensive history. It goes back 20, 30 years, really, since the first set of online courses were started probably towards the end of the 90s. And in early 2000s, when different technology started to become more broadly available, there was a sort of a steady curve and increase in using this in our classrooms, using it, in primary, secondary level, but also universities and workforce settings. Now, what happened in many parts of the world that we didn't see happen in Australia is almost a complete lockdown of school systems, where parents had to basically start to continue their regular job, often working from home, while simultaneously taking care of their children. That has an enormous impact in terms of what we're using with our students and with our classrooms. And as a result, there was a lot of attention being paid to synchronous technologies such as we have here, where you can interact with others in real time, asynchronous technology, interacting in discussion forums, or doing a lot more reading, relying on a range of different resources. So suddenly, rather than the teacher being the primary source of instruction, you often had a greater reliance on online platforms of content that was readily developed. It could be through sites like YouTube, or it could be through Khan Academy, or it could be through a vendor that provides a particular set of learning technologies and opportunities. The experience became parents, globally at least, had to do more and more with technology. Now, interesting impact of this is, as this has grown, the technology in general has grown globally, and more dollars are being put into it, we'll only see an acceleration of it. So I'll say one of the lasting impacts of COVID is going to be greater utilization of technology. It's in more of an augmented role. Even if we resume full-time classes across all levels of the schooling system, we're going to see progressively more and more technologies being used, because there's more dollars flowing into it. Even though Australia wasn't impacted the way the US was, the education market is irrevocably changed. Another aspect that I think is very important, and a sort of final point here, is there's some safety and related concerns that are critical here. When you have students involved in technology spaces, you don't always have control the way you do in a classroom. But you also have harm, if you will, that students can see. They can see things like what's happening in the US right now with the racism and the protests that are going on, or protests around environmental change that occur globally. Students may be exposed to a range of things that are overwhelming, negative, and to which they might not be prepared to be able to properly absorb or adjust or make sense of. And so those are the kinds of questions where technology is a terrific liberator, but by the same account, there's a safety and a security aspect that we need to pay a lot of attention to. But the flip on that is you want to promote safe, secure environments, but by the same account, you can begin to overly survey our students where it's locked down and controlled. And as a result of that, you're basically overprotecting students, so you're not giving them the opportunity to develop self-regulation and autonomy, a lot of the kinds of skill sets that are important for longer term flourishing. So I think there's an interesting relationship between students, the current global setting that we see emerging, pandemics, and the wellness and well-being and the autonomy of developing capable, aware, and socially conscious adults that there's going to be a lot of time for parents, researchers, and teachers to try and work through over the next decade.
Thanks, George. Well, that sort of slots very nicely into you, Leslie Ann. I know a lot of your work has been looking at the impacts of, particularly the influence of media on kids when there are crises like this. And I know it's been pretty, coming at all levels during the COVID outbreak, with newspapers, TV, radio, everything switched on to the impacts of the pandemic. How does that relate to the research that you're doing, and what have you found are the things that parents need to worry about in terms of their children's mental health and well-being?
Well, this year has been a particularly anxious year for our society and our community. So in Australia, first of all, we saw a lot of media coverage on bushfires. We saw media coverage on coronavirus. Now we're seeing media coverage on the riots in America. So these are all very traumatic events that children are being exposed to. Every time we turn on the TV, the radio, there's more news about the events, who's been impacted, what's happening in the immediate aftermath. And it very much depends on how parents respond to that and how parents support their children. So it's largely children's age and parental influence and what type of media they're being exposed to. So as Carol said, not all media is bad. There's some digital technologies and media out there that's very good and educational for children. But some of this more traumatic and negative type of media can be quite harmful for children if it's not managed in the right way. Parents are children's main role models, and children will look up to parents to identify whether there's a need to be fearful or whether things are okay. So the way the parents and other trusted adults respond to these traumas and negative media will inform how children feel like they need to respond. So if parents are fearful, if they're panic buying, if they're worrying, if they're isolating children or stopping them from going out, making them wear masks, that would contribute to children developing fears around what is happening within our world, versus parents that are mindful of shielding their children from some of this really negative media. If it's like media sort of replays in children's heads. So I have an example from my own daughter, who's now 24. She was watching Sesame Street when 9/11 occurred. So that image, Sesame Street stopped and you saw the plane crashing into the Twin Towers. That image replayed in her head over and over, and that took her about 2 years to get over that. She was concerned that Bin Laden was going to come to Australia and harm her because of all the media and the hype around that. And obviously it was very difficult to try and shield children from that negative media when we're having such traumatic incidents occurring, and that needs to be reported. But parents who, in relation to the COVID-19, parents who shield children from that negative media, the tallies of death counts and the concerns that it's going to have, we're going to have a stage 2. If they shield them from that type of media, explain that the virus is dangerous, but also explain what is occurring to try and protect them and protect, Australia and their community. So looking at what the government's doing, what the medical industry is doing, trying to find cures and vaccines, what parents are doing to protect children, what children can do to contribute to protecting themselves. Parents that reinforce, and model safe practices such as hand washing and social distancing are less likely to have those negative impacts on children. But we know also that it depends on the individual child. Some children are naturally anxious and will take all this on and will require much more nurturing and support to be able to, make sense of what's happening in their world and to be able to get through this. So we need to be mindful of the impact that, these exposure of negative media may have on children, because it can cause distress and worry for many months and even years. And we also need to, support children and help them understand what our new normal is and how that's going to, change and shift and gradually get back into what they knew as the normal prior to the COVID-19.
Thanks very much, Leslie Ann. That's really interesting. So that's the sort of the formal presentation part. I'm going to throw it open to some questions. I want to, first of all, thank everyone for sending in quite a lot of questions. We probably won't get through them all, but we've tried to bring through some of the main themes that were sent in from people who've signed on for the webinar. So the first one I'm going to ask to you, Leslie Ann, there's been so much disruption around COVID. A lot of our audience want to know a bit more about the stuff you've just been talking about, the impact of media on children, and probably just some dot points. What are the 5 things parents can do to ensure that that fear that you've been talking about doesn't become anxiety?
Well, media is quite a huge influence on human beings. So we know from research that, viewers of police shows overestimate crime in their area. Viewers of medical shows overestimate the doctor's ability to cure patients. So we sort of make sense of our world through what we're actually seeing in the media. And children obviously also do that. And in Australia, in relation to the COVID, it was, sometimes difficult to try and make sense of what was happening in via the media. So if we had a look at, some of the restrictions that were being put in place, because there were so many reports, it was quite confusing because there were different restrictions put in place in different states and territories, depending on the severity of and the risk factors in those states and territories. So for young children, or for children and particularly young children, it's even more difficult for them to try and get their head around that. So they use media alongside their parents to make sense of their world. So parents' responses are very key in relation to helping children make sense of media.
Is it better, Leslie Ann, to sort of sit down and watch the news with them and then unpack it for them, or is it better sort of to just tell them the facts?
Depends on the age.
Right.
So for very young children, I wouldn't recommend very young children be watching the news. There's just too much negative and traumatic, potentially traumatic events on there for them to be able to process. So for young children, I'd recommend, shielding them from the news, when possible. For middle to older children, co-viewing with them and explaining, what's going on, what this means for them, what this means for example, the riots that are occurring at the moment. It's dreadful. It's something that needs to be explained to children in relation to what is occurring, what's behind that, but also explaining that, in Australia at the moment, we're safe from that. It's not occurring. It's not going to, come over here in the immediate future. We need to be honest with children. So, age appropriate explaining and talking to them about it in a non-fearful way. reiterate what we're doing to protect ourselves, where we're moving forward, how we're moving forward, and the thought and concerns that have gone behind making all those decisions. Checking in on your kids, finding out what they know about it, whether they've got any questions or concerns, and letting them know that they can come to you with those questions or concerns. And also reiterating that in relation to COVID virus, it's something that, you know, we've lived through it once, and we can get through it again. And you know, discussing with them, giving them a voice to help them, you know, contribute to, you know, some of the ideas that you can do as a family to help protect, and helping them to understand that honesty is probably the key thing, but it needs to be age-appropriate information that's being shared with children.
Great, thank you. Carol, in normal times, we're always urging our kids to get off the couch and to go out and play and stop being lazy and turn off that computer. But COVID has been sort of like we've chucked that all out the door and said, well, righto, you have to stay home, you can't do anything and don't go to the park. A lot of the people have asked questions about how you can encourage children to set their own healthy goals, and, you know, whether that be in the situation that we've just had in lockdown or as we move into opening up a bit more, but giving them the tools to manage their own their technology use in ways that are healthy. Do you have any tips?
Yeah,
on that?
sure. Yeah, it's a really good question, and I agree that in some ways you could say it's conflicting that, you know, we're saying not to use technology, but do use technology for homeschooling and so on. But I guess I would probably be an advocate of, well, actually use technology to your advantage, because there's actually a lot of really fantastic resources that are tech-based that actually help kids and adults be more active. You know, for example, you know, there's been a massive uptake in YouTube exercise classes and Zoom exercise classes. I was actually just reading how research is coming out showing that a lot of people are considering not returning to the gym because they've replaced the gym with these home-based classes and actually, you know, find them really good. You know, and some of those are aimed at children. Quite a lot of them are. You know, the beauty of it is those classes are aimed at every interest. You know, yoga, dance, getting stronger, and so on. And then I think some other really neat resources are, you know, especially at the moment where, you know, sport isn't playing as big a role in kids' lives. You know, I think if you can, you know, work with your kids to try to get them you know, engaged with the idea of a particular goal that they could work on. You know, with one of my kids, he decided that he would try to improve his basketball accuracy. So, you know, he's watched some videos of, you know, really great basketballers, you know, giving their techniques and their like training tips. And then, you know, he goes out and practices his shots every day and he's improved stacks. And also, you know, one of my other kids, their soccer coach has actually made them learn to juggle a soccer ball. So there's kind of neat goals like that kids can work on that, you know, give them good skills that will improve their game when they return to sport. And then I think one other potential way of engaging kids with staying active is through wearables. So, you know, the Fitbits, Garmin's, and also there's lots of sort of cheaper, no-name versions of those as well that really are very inexpensive. And you know, and if kids haven't done it before, it's really it's really easy for them to get hooked on, you know, oh, I want to go and, you know, how many steps can I get in the next 5 minutes? Oh, gee, you know, today I haven't done many steps compared with yesterday. Can I go to the park? So, you know, that kind of step counting stuff where they can actually track their progress over time, you know, is really motivating for a lot of kids as well.
Excellent. Thanks for that. Some good tips there. George, people are also interested in what the move online has meant for educating children. They want to know about the place of online learning in the future and how we ensure that online models of teaching are fair and equitable. And this was one of the big questions. They were interested in what long-term repercussions there were for children who may not all have equal access to technology, and what policies might deliver equity for marginalised kids?
A number of questions tied in there, so I'll sort of tackle the first one. Is first of all, the opportunities to learn with technology are quite significant and really do in a number of ways change our view of what should happen in a traditional classroom, because there are more opportunities for engaged, active learning. There are more opportunities for students to collaborate with peers from around the world. And so there's a number of different approaches that educators who are willing to be a little bit more experimental in how they interact with their students can really improve the richness of that learning experience. The challenges, though, that arise is technology amplifies existing inequities in society. And if you start to move online, let's say you're going to use a virtual reality headset, well, there's dollars required to get that, or you're going to use mobile learning or clickers in a classroom or some kind of game-based learning. Well, once again, there are additional expenses and technologies that are required. Let's say you have a group of Aboriginal students in a remote region of the country or the state. They may not have access to a type of bandwidth that's you're going to have if you're living in a nice area of Adelaide, for example. So there's a number of things that technology at a base level does well. It helps to make learning more engaging if it's used properly. It helps to make learning more globally, where you can get in touch with the experience of students in India or Africa or America or Mexico and so on. With a little bit of creativity, you can have very rich learning experiences. The difficulty, though, and there's a good degree of research that supports this, is when you add technology to an existing learning experience, you almost always amplify the divides that are already in place. And instead of it being an equalizing agent or something that increases the capability of students, it's just one more brick in the wall, so to speak, that prevents students from equally getting access to successful or effective learning experiences. The way to move around it, I think, first of all, and I really want to be topical here. I know, obviously, I'm Canadian, but I've been in the US for the last 6 or 7 years. And so I was seeing what's unfolding in the US is really quite relevant. And I just want to briefly touch on that. Is inequalities in society don't resolve on their own. It's not like we can ride this out and then in a decade, everybody will be good. Like, you have to intentionally and structurally tackle the challenges that underrepresented populations face. Those are sometimes social, sometimes they are economic, sometimes there are some cultural dynamics that need to be addressed as well. So to your final question, Michelle, the way to, or the way through or around some of the limitations that technology presents to underrepresented populations is to confront it head on, identify the experience, listen to the experiences of people who are facing those realities. What are the needs that they have? Because in some cases, we have an assumption that our learners need to change their practices to succeed in our system. When it comes to underrepresented students, you quite often have to think, what about our existing system has to be changed in order to more broadly include those students? Now, that's a long-term view. It's something that can take decades to do, but it is important, if you're seeing growing inequality arise from technology use, to tackle it head on and begin to identify where are the key points in the system that need to change so that everyone does have access to opportunities.
Absolutely, George. It sounds like something that our governments and educators need to take on as a project. So I'm going to go back to you, Lesley-Anne, and just ask you about, we've talked about anxiety.
Yep.
I want to know that, like, in a month or so, how are you going to tell whether your child has really been impacted by this? What are the signs of anxiety, and what do you do once you feel it really has made some sort of impact on your child?
Well, some kids will keep the topic open. They'll keep asking questions about it. They may have developed fears. So they might have a fear of people in a mask or getting too close to people. They might not want to go to school. They might try to sort of self-isolate because of the social distancing that has occurred, and their fear of catching the virus. They might show regression in some of their learning and development, so they might not be focused on school or their learning, or they might be clingy to parents and not want to leave. They might start bedwetting or something along those lines. So they're all, indicators that the child has been traumatized in some way. They might have nightmares. What can be done? Obviously, you would be, reiterating to children that they're safe. You might get professional help if required, if the child isn't coping still. So, booking to see a psychologist or other forms of help. Reiterating, I guess trying to relax their fears or reiterate that, some of the fears that they have, may not be something to be fearful about. Yeah.
So, Lesley-Anne, in a classroom setting, is this something that teachers could, is it safe for teachers to actually open it up as a topic and make it a part of learning and give kids some sense of being empowered about the research around, feelings of uncertainty in society and that kind of thing? Sometimes they do that in classrooms as a project, and that helps kids unpack the information. Is that something teachers would be wise to do?
I think so, because in classrooms, it's impacting children in classrooms. So it's very difficult to social distance in a classroom. So you need to sort of amp up the hygiene practices, remind children to wash their hands when they arrive, after recess, after lunch, having hand wipes available, wipes to wipe down surfaces, sanitizer, and children want to know, why that's around. So it's a great opportunity to open the communication for children, help explain what is happening, help them to understand that and unpack that, answer any questions, monitor children's fears, help settle their fears, being calm, role modelling some of those practices yourself, and educating children rather than, I guess, reprimanding them. So if children are not social distancing, it's, that's a really difficult thing to do. Children are playing, they're in classrooms together. All of a sudden, we have to social distance. And even as an adult, we have to be reminded to social distance in supermarkets and whatnot. So for children, it's natural for them to, play in close proximity and so they need to be reminded of those things, and it really gives educators a great platform and an opportunity to explain, what is happening, where we're going, sort of lessen children's fears, help them understand what is going on. So I think taking it to the classroom will support parents as well. So it will help parents to be able to understand how to explain things to their children. And it will also help children to understand that.
Could be the next science project.
It could be.
Yeah. Carol, there's been a lot of talk about the negative impacts of COVID and predictions about increased rates of suicide, those sorts of things. But early evidence is perhaps, I don't know, I think you've said to me that early evidence is suggesting it's not as bad as perhaps people have said it might be. Can you explain that a little bit more?
Yeah, well, we've got a study underway at the moment where we were going to be recruiting several hundred Adelaide adults and tracking them for a year, looking at their activity patterns, diet and changes in health and wellbeing. We'd already recruited some of them when coronavirus set in and put a halt to the rest of recruitment for the time being. But it does mean that we can look at what's happened in the adults that we had already enrolled into the study. And interestingly, so we have been tracking their anxiety, depression, stress, general wellbeing since just before Christmas. And we actually, when we've looked at what's happening, we can't see any discernible changes in stress, anxiety and depression in the adults that we're currently tracking, which did come as a surprise to us. Now it's at the group level. There's no obvious group level change. you know, I'm sure there may be individual cases that, you know, are really psychologically suffering. But yeah, we were surprised to see that no obvious change. And I think perhaps, you know, reflecting back on it, you know, we sort of discussed it as our research team, and we were like, well, you know, we all probably felt quite stressed for a short time when all the changes were upon us, and suddenly we weren't allowed to go to work, and kids were, you know, perhaps not safe at school, and cafes closing and all that. You know, at that time, you know, life as we knew it was suddenly changing a lot. And I think perhaps for a couple of days we, you know, felt a lot of stress. But probably for a lot of people that has now kind of settled into a new normal, and people are actually feeling quite comfortable. You know, I think here in South Australia in particular, but also Australia, we're somewhat buffered from what's happening, you know, internationally, where there's actually probably not a great sense of personal danger. With all the measures that have been put in place, you know, the rates are really being controlled very effectively. So, you know, I don't think we're seeing the negative psychological impacts that we were expecting. And if looking at what we know about mental health more broadly in the community, you know, interestingly, there's a lot fewer mental health patients presenting to emergency departments at the moment. You know, not surprisingly, there's just like basically a lot of people are trying to stay away from hospitals, but that includes mental health patients. There has been some rise in the number of people calling helplines, but that potentially is pretty much maybe just offsetting the people who aren't actually physically presenting, wanting medical assistance. So, you know, at this stage, I don't think we're seeing, you know, the really dramatic negative, you know, fallout that we were expecting. I guess, you know, time will tell what happens in the longer term.
If someone is struggling with a sense of depression or whatever, is there a kind of a basic exercise regime that might be beneficial?
Oh,
for kids or adults?
Like, okay. So exercise does help mental health issues, especially around stress, anxiety, and depression. That's been really well established. But certainly, if someone was experiencing a change in those symptoms, you know, we would encourage them to get, you know, sort of formal assistance with that. To actually see, you know, what level of help they need. But it's likely that a medical professional they see will encourage them to look at their lifestyle as part of their management, you know, making sure they're eating well, getting enough sleep, maintaining healthy sleep patterns, and also maintaining exercise, because all those things really do help people stay in a better mindset.
So I'm going to ask this question to everyone. As we're all preparing to go back to, well, kids have already gone back to school, but parents going back to work, changing their patterns again in terms of how they interact with family and their children. Have you got any tips for that sort of return, that re-engagement with society, and anything that we need to worry about in terms of learning or lifestyle or just a sense of mental well-being?
I'll go first, Michelle.
You go first, yeah, okay.
I've largely focused on the negative media and how that is harmful and how it can impact kids. It's also important moving forward, you know, looking back on what you did as a family. I know that there was you know, a lot of things that I saw on Facebook and through research in relation to what families were doing together. It sort of strengthened some of their bonds. They were spending more time together. They were playing together more. So there was a lot of, you know, good that come out of you know, being locked down. And I think it would be helpful for, you know, to reflect on that with your kids and you know, focus on some of the positives as well. So manage the negatives, manage, you know, the impact if they have been traumatized, but also, you know, focus on some of the good things, the good news stories that, you know, have occurred. even things like I'm part of a Facebook group called View from My Window. And it's brilliant, looking at some of the views that people from other countries have. So sharing that type of thing with kids and helping them to understand that, there are positives. There's always positives that come out of, some of these challenging times, and helping them to sort of identify those as well, so that it lessens, some of the potential anxieties around it, and so they can see that with every challenge, there's always something good to find in that.
George, for kids going back to school, this has been a bit of a nightmare. 1 minute you're at school, you have to come home, you have to study online. Next minute you've got to go back to school, be with all your friends again, but don't touch them. What tips have you got for the return to school?
I think most of my tips would be directed to parents. So first of all, I think it's important for parents to become aware of what are the options, what's available. What are your children doing in terms of their technology use? What are the tools that they're using and that you're hearing about? Because one of the aspects within certainly psychological research that has been reasonably well documented is just the way that video games or media use impacts our own perceptions and our own motivations, and a number of ways that getting involved in certain communities or sub-communities online can be perhaps damaging to students. So I think the first advice I would say is for parents that as your kids are going back to school, they've likely spent more time online than they would have traditionally for a lot of the things that Carol and Leslie Ann have chatted about. But because they've spent more time online, do you know what they were looking at? Who are the people that they're talking to when they come home and they're talking about they're on Discord or they're on TikTok, or do you know what that actually means as a parent? Don't cop out with the proverbial, oh, I'm too old to figure that stuff out. I mean, that's nonsense, really. I know people who are like 70 years old that are more active with technology than 25-year-olds, just simply because they have an aspirational motivation toward using technology in a meaningful way. So I think take personal ownership for the technologies your students are interacting with, the sites that they're visiting, the people that they're interacting with, and so on. I think that's really a starting point. Beyond that, though, from a student perspective, I think, I was thinking this the other day. I was listening to a podcast, I was going for a walk, and I was reflecting on what an absolutely stunning time to be alive from a learning perspective. I can listen to a world expert narrate her book to me while I'm going for a walk along the river. I mean, it's just amazing. If I want to learn a new concept about statistics, if I want to learn a new concept about, fixing something wrong in my garage, there's something on YouTube. Somebody's explained it and somebody's recorded a video of it. So I really think modeling that kind of positive engagement with technology and learning is a fantastic gift that parents can pass along to their children as well. So I'd certainly encourage that aspect too.
That's excellent. Yes, and true. So true. Carol, I suppose you're going to say that we should all be on our scooters going back to school so that we can make up exercise. What would you suggest?
Well, I think an advantage to what we've just gone through and coming out of is the fact that our lives were simplified dramatically. A lot of things were taken out of, a lot of the commitments were taken out of our lives, and I think it's a really great opportunity to reflect on which ones do you want to put back in. Which commitments are actually meaningful and important to you, and perhaps which ones can you let go, because I think a lot of people are like feeling less stressed just simply because they don't have they're not racing around to so many different events and commitments at the moment. So I think I would really encourage people, as their lives start to get busier again, try to take some of the good that's come out of this isolation period with you into the future, whether that's, spending more time, with the people that you care about, and also you will need to start, I guess, thinking about how you fit everything back in again. So I would obviously be encouraging everyone to try to fit physical activity in there. But, keep it to physical activity that you enjoy. It doesn't have to be about, doing a really intense workout. do stuff you enjoy, you know, and if it can be with people, yeah, if you can enjoy it with other people, then, you know, that's perfect as well. You can do it with family or friends and so on. And I guess the other thing would be just to be mindful of screen time. Don't kind of let it creep into too many facets of your life. Just, you know, keep it in balance so that you're getting the good and avoiding the bad.
So don't watch the whole series of a program on Netflix at one time. Is that what you said?
No, spread it out.
Okay, I'll take that on board. George, one of the questions that people have asked is about what sorts of technologies might be most important in classrooms for children, you know, as we come out of COVID. What do you think are the lasting things, the things that are really going to be a part of the education system?
That's a great question, and it's a difficult one to address because there's a series of background issues, such as what are the funding resources available for different technologies, what are the constraints the teachers are dealing with, and so on. So it's not a question that can be sort of answered in a vacuum. There's a series of sort of compounding factors that will determine exactly the direction that we go. So I'll speak to it in an abstract sense rather than a specific sense. I think in an abstract sense, technology should enable people to better relate to others. Point one. Secondly, it should enable students to begin to get support for areas of difficulty that they have in mastering certain content and materials, which is proven to be in maths learning, for example. There's a range of tool sets available that can really help to address discrete areas of misunderstanding that students have, and then provide sort of nudging or automated support on best directions to go. So I think that's a second level. But I think technology should help students to become more human. And what I mean with that is it should improve their self-regulatory capability. It should improve their ability to be autonomous and creative learners and so on. So there's a lot that we do in a classroom that isn't necessarily hugely valuable to the development of a student. And increasingly more and more of the curriculum that we're teaching our students now is going to be obsolete in a reasonably short period of time because the world changes, knowledge is changing more rapidly than ever before. And I think there's a need for us to start to question, and this is again a longer term conversation, but what is schooling there for? What is it supposed to do? And what role might technology play to support and to direct students in that kind of a setting? So for my general view, I would say it should enable students to better connect with one another. It should enable them to learn better, and it should enable them to become better people. It would sort of be the criteria I would look for with the kinds of technologies that are being used in schools and classrooms. Quite often that means sometimes you should just shut everything down. I think a real skill for students to learn is to not touch their mobile phone, to not go to the internet, to not open a laptop, or to not touch a tablet. Like unlearning that reliance on automated habit is, I think, one of the key things that schools should be helping students to develop, so they have a more mindful, more thoughtful way of engaging with the world and with people around them as well.
Great advice. Look, I'm going to start wrapping up. Thanks everyone for the questions that you sent in. They have been really useful and helped our researchers talk about some of the areas that they know quite a bit about and share that information with you. But I'm going to end off by asking you all, I suppose, you know, from your personal experience and your research experience, what would be your one take-home message for the people that have joined us today? I'll start with you, Lesley-Anne. Just the one take-home message, and like I said, based on your research, but also based on your own experience of these times.
Okay, I guess be mindful of the potential impact that media has on yourselves as well as your children, and make sure that you explain, that you co-view and explain things when there are traumatic events occurring, so that it lessens the risk of children being traumatized by that.
Carol? I made some interesting observations the other day about what it's like to be a parent in these times.
Yeah, it's a lot easier now that they're back at school. Yeah, so I think I would just suggest you strive for a balanced lifestyle. Find physical activities that you and your kids can do that you can enjoy together, and then if you want to unwind with some screen time, that's absolutely fine too. Just keep it balanced.
Great. And George?
I think my advice would be get involved in what your children are doing with technology, understand the tools they're using, the games they're playing, the sites they're visiting, and the friends that they have online would be my primary takeaway. Secondary, I would say dive in as well. There are tremendous mental and emotional health benefits to being an active learner. And there's a range of open online courses that parents can take, but start to model what it means to be a learner for the duration of your life. Pick up a new habit, a new skill. I think if you haven't used the internet for learning yourself, you'll be amazed when you visit sites like edX or Coursera or others where you can take university level courses in roughly every single topic you can conceivably imagine. I mean, the internet is this incredible learning machine that's being vastly underutilized. And that's so parents, I'd encourage them to dive in and start learning.
Thank you so much. Look, I've learned a lot today, and I hope everybody else who has listened in has also learned a lot. Thank you so much for your time, Leslie Ann, Carol and George, and thank you for everyone for coming and being part of this, this webinar. I hope you've enjoyed it and that you've learned a lot. If you have questions post this, we will be sending out a recording to everyone who joined up and some other materials, but we can also take questions if you've got anything more you want to ask us. Thanks again, everyone, and I've really enjoyed the time. I hope you have too.